Just hearing the word root canal sends some people into a panic, but understanding exactly what the procedure is can certainly help to ease some of those fears. I'm at Sunrise Dental at the Raleigh location talking with Dr. Brian Meckler to get a better understanding about root canals and really why it doesn't have to be so bad, right?
Usually it's not. I mean, it really has been portrayed as something that's awful, and it really doesn't have to be.
Okay, first, can you define it for me?
Yes. Typically, when someone needs a root canal, it's usually due to inflammation with the nerve, which is inside the center of the tooth. And if the nerve gets to a point where it can't handle the daily stresses of chewing, drinking, hot food, cold liquids, trauma, the nerve can act up and cause a lot of pain. Okay. And the root canal is a procedure by which we remove the inside of the nerve from the tooth. You still keep the tooth, but the nerve inside the tooth is removed.
If you get a root canal on a tooth, is that it? That root is removed. You never have to worry about that tooth again?
Not necessarily.
Okay.
The root, in fact, is still going to be inside your mouth. And we don't remove the root. We remove the tissue that's inside the root. Once that tissue is removed, if it's done well, the success rate for a root canal is 98%, and it alleviates pain. But the root canal is not the final step in the procedure. I mean, after you get a root canal, you need to protect that investment that you've made, and in order to do that, you need to protect the tooth with a crown.
So if someone does have to undergo a root canal, what can they expect? What's the process like?
Well, I think the key to any dental procedure is to make sure that you get the patient very, very numb. And we spend a lot of time doing that before we proceed with any dental procedure, is making sure that our patients can't feel anything. Once you do that, it's typically an hour to an hour and a half appointment. There's no pain involved. It's basically kind of like roto-rootering the inside of the tooth and getting out all the bad stuff and sealing it up.
Well, you are an expert, so if someone comes here, they're in good hands, knowing that they're working with someone who knows what they're doing.
Most patients that need root canals have had incredible pain. I mean, it's mind-altering, just if I could pull the tooth myself, I would kind of situation.
Right.
When they come in for that procedure with that kind of toothache, if they're seeing someone who has done a fair amount of root canals and feels very comfortable doing it, then they're going to be in a position where they get numbed up, they get the root canal done, and their pain goes away. My biggest thing is, I tell all my patients, it's one of those things that if you can keep your mouth open while we work, it's really no different than doing any of the other procedures we do. It may take a little bit longer, but you shouldn't feel anything.
Well, that's certainly helped to alleviate some fear, and I'm going to do some extra brushing and flossing to make sure I don't have to do it. Dr. Meckler, thank you.
My pleasure.
You can learn more about Sunrise Dental. Just be sure to visit the website.